All right. Well, welcome everybody to Beneath the Surface lecture with Marine Mammal Care Center. I'm glad everybody can join us tonight. My name is Dave. I'm the I'm not a director, I'm the Chief Operations and Education Officer at the Marine Mammal Care Center. I'm joined today by Madison Peters. And we have everybody kind of signing on right now. So just for a little bit, I'm going to bring everybody on. And we'll start in just a minute with Madison's lecture. So we're just going to get everybody admitted, and then we're going to begin. So give us just a second. All right, it looks like the flood of people entering has slowed down a little bit, so we're going to go ahead and get started. Um, Welcome again. My name is Dave, and I'm here to introduce to you Dr. Madison Peters. She's a veterinarian specializing in marine mammal health and conservation medicine. She's first joined the Marine Mammal Care Center as an associate veterinarian and senior fellow in July of 2024. Prior to joining the Marine Mammal Care Center, Madison worked as a veterinary research associate at the Marine Mammal Center in Sausalito, California, where she focused on research related to antimicrobial resistance, infectious disease, and clinical medicine. Madison earned her bachelor's degree in biology from Wesleyan University and graduated from the Cummings School of Veterinary Medicine at Tufts University with a combined Master of Public Health degree. She performed her master's research on Vibrio and oysters in relationship to food safety. And I'll just add that I believe Madison is a wonderful human being. She's such a joy to have to work with here and has been doing some really amazing work with our animals. And I'm so excited to hear her lecture today titled From Rescue to Research, How Marine Mammal Rehabilitation Informs Conservation. I would ask that everybody remain muted today while we have our lecture. And at the end, we're going to have some time for question and answer. If you have a question during the lecture that you don't want to forget, you can put it into the chat and we will save those to ask at the end of the lecture. I'll be manning the chat as well. So without further ado, I'd like to throw it off to Madison Peters and let's get started.
All right. Thanks, Dave. Thank you, everyone, for joining, for being here to listen to me talk about one of my favorite topics, which is opportunities for research in my job as a marine mammal rehab veterinarian. So let's get started. All right, so many of you are probably familiar with our mission at Marine Mammal Care Center, but our mission is to inspire ocean conservation through rescue, rehabilitation, education, and research. And we respond to stranded marine mammals in Los Angeles County. We actually have the most marine mammal rescues per mile of coastline in the US. And because LA County is highly developed, there isn't that much shoreline habitat for marine mammals. So because of this, because of how populated our beaches are, there's this public health and safety aspect as well as animal welfare issues that arise when marine mammals strand on our beaches. Our response program receives over 750 annual rescue calls, and we rehabilitate over 250 marine mammals annually. And since 1992, the Marine Mammal Care Center has treated over 10,000 individual patients, which provides, 10,000 opportunities for research and for us to learn about these animals. So that's what we're going to get into a little bit tonight. Uh, in our rehabilitation hospital, animals come in for a variety of reasons. One of the most common ones is malnutrition. So those pups over on the right, those pups stranded as malnourished pups, they're in good body condition in that photo, but that's a common cause of stranding is malnutrition, often related to premature maternal separation. We also treat animals for human interaction, including entanglements, like the one you see in that middle photo, and gunshots. And then also infectious disease. That photo on the left is me ultrasounding the kidneys of a sea lion. We see a lot of infectious disease that impacts the kidneys, especially a bacteria called, or a bacterial infection called leptospirosis, which we're going to talk about a little bit more later. And then also another common cause of stranding and entering into rehabilitation is biotoxin exposure. Like you guys might have heard of domoic acid toxicity, which we see with some regularity in California sea lions in particular, especially right now. So those are some causes of our patients showing up in rehabilitation. But regardless of what they stranded for, rehabilitation provides a unique opportunity for research because it's really a snapshot of time in the lifespan of a wild animal during which we have access to them for sample collection and to gain a better understanding of the cause of stranding. And, our goal with rehabilitation is to release patients at the end, but even those that don't get released, that pass away in our care, we have a huge opportunity to learn from those animals and collect samples from them. And so I think because rehabilitation provides such a unique opportunity for this sort of knowledge and access to these patients, it's really our responsibility to do our very best to gain as much information as we can from them while they're in our care. So, as veterinarians, or not just veterinarians, really specialists in marine mammal rehab in general, we have the opportunity for involvement in research at various levels and various types of research projects. For the purposes of our conversation tonight, I'm going to break these research projects that I'm going to be talking about into three categories: clinical, population health, and ecosystem health studies. Now, this is really just to make our discussion simpler. I think really you could argue that each of these projects I'm going to be talking about could have a place in each of these categories. It's not so black and white, but just for simplicity's sake, that's kind of how we're going to structure things tonight. I also want to highlight that we have the opportunity to be involved in research in a variety of different roles. So some of them we, as marine mammal veterinarians or people who work in a marine mammal rehab setting, can be involved as a principal investigator, leading the research project and developing it. We can also collaborate with others on their projects, particularly providing samples because we do have, unique access to our patients, to these animals. And then we can also play supportive roles, assisting with field work, things like that, as we're going to talk about, particularly as it relates to those population health studies. So, first, to get into a couple of clinical research projects I want to highlight for you guys, we're going to talk about one on fecal microbiota transplantation, and then we're going to get into one on rapid diagnostics for leptospirosis, that bacterial infection I mentioned earlier. Um, and that picture that you see there is of three weaned elephant seal pups in very good body condition in the wild that were part of a study on antimicrobial resistance that we're going to talk about later on. So first up, fecal microbiota transplantation, or FMT, as I'll refer to it. This is kind of what it sounds like. A fecal transplant involves instilling fecal material from a healthy donor into the GI tract of an unhealthy gut. And that image on the right is from the Cleveland Clinic. That's actually to describe how it's utilized in human medicine, which is relatively frequent. They use it to treat clostridial infection or things like inflammatory bowel disease. This treatment strategy has been employed in a few wildlife species. Some that I found in the literature include dolphins, sloths, and cheetahs. But really, why we wanted to look at this as a treatment strategy for our stranded marine mammal patients is because we see animals that are severely malnourished. And we also, by the nature of having them in rehab, we're having them experience diet shifts, altering what they would normally be eating. And often, especially the malnourished ones, haven't been eating for quite some time before they enter our care. And then we also see bacterial infections and things like that. So, this FMT project that I have been collaborating on is a project that we are doing on elephant seal pups in rehabilitation. The primary researcher on this project is Sophie Girashi. She's at the Marine Mammal Center, and we started this project together because we wanted to see whether instilling FMTs into the tube feeding of our northern elephant seal pups would improve their outcomes in rehabilitation. So we're giving them the FMTs, but in doing so, we're also, doing the science to try to evaluate how well our treatment is working. And some ways we're doing that are by looking at the microbiome. So what bacteria are present within the GI tract, serum cobalamin and folate, which are markers of gastrointestinal absorption, and then weight and feeding parameters like how quickly animals transition onto fish and things like that. And this is a project that we got IACUC approval for, which means that a committee reviewed it and reviewed our goals and objectives and study design with animal welfare in mind to make sure that it was a valid study in that way. It's also a collaboration with multiple people, but namely the Smithsonian, especially Sally Bornbush at Smithsonian, has done multiple studies like this and has been a huge asset for this project. So definitely a collaborative one. And we did receive some small grant funding for it through the Oiled Wildlife Care Network in Missouri. Um, One of the reasons I am really excited about this project in particular is because I think there's just such an easy, direct link to how it might improve outcomes for our patients. If instilling FMTs into the diet of malnourished patients, not just elephant seals. Elephant seals are kind of a jumping off point, but other species we treat, including threatened species, it could be really huge for our rehabilitation program and kind of a direct link to improve patient outcomes. And then the other factor, of course, is that all you need for it is donor feces, which we do have access to, plenty of it. And it's also an inexpensive treatment strategy. So I think it really could be beneficial in multiple ways if it works. So we'll see. Hopefully it will. We actually started collecting samples and administering the FMTs last year, and we're continuing it this spring. So don't have any results for you until we finish the whole study, but something exciting that we have that we're working on. Another project that I wanted to talk to you guys about is one that has similar clinical application for our patients in rehab. And this has to do with diagnosing leptospirosis in California sea lions. So, leptospirosis is a zoonotic disease. It's a bacterial infection caused by bacteria of the genus Leptospira. Um, One type of Leptospira, it's Leptospira interrogancia or pomona, is actually endemic in California sea lions. So we do see leptospirosis in sea lions stranded along the California coast with some frequency. Um, Clinical signs of this disease in our stranded animals include dehydration, polydipsia, which means increased thirst. So that animal you can see on the top image is very clinically dehydrated. There's sunken eyes and also very thirsty. He's been drinking out of that water dish. Hyporexia, which means decreased appetite, and abdominal discomfort, which of course can be a little bit tricky to evaluate in our patients, but we perceive abdominal discomfort as tucking those front flippers tightly against the abdomen, the way that animal is in the bottom image. There are ways to diagnose leptospirosis, including serologic tests and other, PCR, all sorts of tests really, but they all involve sending them out to a lab. All of the established methods at least involve sending them out to a lab, which can take some time. And you have to have the right samples to send, of course. Um, so for this study, we wanted to look at two rapid tests. So bench side, pen side, whatever you want to call it, rapid tests that you can do. You get results within 10 or 15 minutes if you have a blood sample to use. And these are commercially available tests that are used frequently in small animal medicine. So at a small animal hospital, you might have heard of if your dog has ever been tested for leptospirosis, one of these tests might have been used. Um, and the benefit is that, you get results right away. These are both antibody tests, so they test whether the animal has been exposed to the bacteria. The witness test on the left detects IgM, which is a type of antibody that shows up early on in infection. So this test, when we're thinking about leptospirosis in species like dogs, has a higher sensitivity early in infection compared with the SNAP test on the right. The SNAP test is also an antibody test, but just detects a different type, um, and isn't specific for that one type IgM. So they function a little bit differently, but they're both similar in that they're rapid kind of bench side tests that you can use with a blood sample to diagnose leptospirosis. So for this study, we wanted to look at whether we could use these tests on sea lion blood to see how similar these results were to the results of the tests that we send out to a lab to obtain results from. And for our patients in rehab, one of the big benefits of obtaining this diagnosis right away, even though the clinical signs and also biochemical changes, so changes on the blood work that you can see do definitely strongly point us in a direction of that diagnosis right off the bat. But having that confirmation is valuable because this disease is zoonotic, so it can infect people. We want to make sure that people who are exposed to these patients are wearing the appropriate PPE to protect themselves from infection. We also want to isolate these patients to prevent transmission to other animals in our care. So as I mentioned, we just wanted to compare results of these two rapid tests with the test that we were already using, the MAT. That's another type of serologic test. Um, I'm not going to get into the study design itself too much, but just some key takeaways that we were able to find is that if that SNAP test, the test that was on the right, is negative, that's useful in being able to rule out a leptospirosis infection in rehab or for an outbreak response. If it's positive, that's indicative of previous exposure because, like I said, it's an antibody test, which may indicate current infection and a cause of stranding. In rehab, a combination of a positive test plus those clinical signs and changes on blood work that we see is a pretty good way to diagnose it. And then the witness test, the other rapid test that was on the left, actually was not useful in this setting. They were all negative. And we think the reason for that is just because we were using serum only from stranded animals here. And our patients are very resilient. They have to be quite sick to end up on a beach and get rescued and be brought into rehab. So we think that by that time, the infection is just not that acute. They've been dealing with it for a while. And so that antibody that test looks for had already declined. We don't know that's true based on the study. That's just our hypothesis, but all those tests were negative. So at least in a rehabilitation setting, not useful to us. Now, it could possibly be useful for sea lions, say, in a managed care setting in a zoo or aquarium that became acutely sick. But I can't speak to that from the rehabilitation side of things, at least. But so this study was cool in that we used samples that we had at our disposal in rehab to evaluate whether we can use these tools to diagnose future patients. So a pretty simple study to be able to apply clinically to our patients in the future. Okay, so the next category we're going to get into is population health studies. And the two that I'm going to focus on are both kind of field population health studies that I participated in one of them, and then another veterinarian participated in another, but kind of to give you an example of how veterinarians can provide support for research in the field on marine mammals. All right, so first, Guadalupe Island. I was able to provide veterinary support for research happening on Guadalupe fur seals. I actually went most recently this past December, and this comes in the form for me. What I was doing field anesthesia there. So the researchers need to have the animals immobilized under anesthesia so that they can apply satellite tags and collect samples and everything. And so that's where my role as a veterinarian comes in. I can do the anesthesia, monitor the patients, and make sure that they are doing okay while the procedure is going on. And so this is a study that Tanaya Norris leads, as well as Fernando Elorriaga at CCMAR, which is in La Paz. And it has been going on for a number of years, but I just got involved in the last year. Guadalupe Island is off of the coast of Baja. It's a volcanic island kind of way out there, and it's the only well-established breeding site for Guadalupe fur seals, which are listed as threatened in the US and endangered in Mexico. So, important from a conservation perspective to be able to perform these studies to learn more about them. And the studies that they've been able to perform through making it out to Guadalupe Island to immobilize these animals and collect samples are really looking at telemetry. So, where they're going, their overall health assessments, and trophic ecology. But, as part of that, there's been the need for field anesthesia. And so it actually also led to a publication on field anesthesia practices on the species, which is pretty cool. I think that's something that Lorraine Barbosa published in 2024, just last year. And that picture is the team that went out most recently in December. We were anesthetizing mom pup pairs on the island to place satellite tags and collect samples, including blood, milk, fur, whiskers, uh, for various research projects. So, a pretty cool opportunity that I was really happy to get to be a part of. I'm going to play this video for you, or at least part of it. Jeff Harris, someone who collaborates on this project and was out on the island with us. You'll see him in the video. He put this together through a series of drone clips that he took just to kind of give you a better sense of what we're doing out there. So we're capturing the animals in, just where they are on the kind of beach. It's more rocky. And capturing mom pup pairs and then anesthetizing them so that we can do all the sample collection and place the satellite tags and then recovering them and letting them go about their day. And then the study also involves resighting them and, more monitoring. But just to give you a sense of kind of what we're looking at here and some of the challenges that we face in this location in particular. As you can see, they're kind of hard to see unless they're moving. They camouflage quite well. They're quick. It's also not easy terrain to run around on. It's rocky and difficult. So having the skills handling these animals to be able to even just capture them is something that is, the most important first step in doing any of this. So you can see on the left, the mom has been captured. And so now there's other people monitoring to make sure that we got the right pup that goes with the mom because we wanted the pairs. Then we suspend them from this wooden pole and weigh them. And then we put them on this cot that we move to wherever we capture them at and put them under anesthesia. So that's kind of how it works. And the anesthesia part is really, why I get to go and even get the opportunity to work with these awesome biologists who are doing this conservation research. It's cool for me to even get to be a part of it. So that's what it looks like when we have the animal on the cot anesthetized so we can collect the samples. And I believe, yeah, he zooms out to just kind of get a better sense of where we're at. It's a very beautiful place to spend some time. It's a pretty harsh environment also, um, but a pretty cool experience to be a part of. All right. Oh, this is just another cool image that shows it's a thermal drone image that was taken of the southern part of Guadalupe Island where the breeding site is for Guadalupe fur seals. Um, all those little white dots are animals. They're lit up because of the heat they're giving off in relation to the rocks. And so I just thought it was cool to show you some of the tools that the biologists use to be able to count and monitor the animals. And it looks nice. It's a beautiful place. Okay, the next population health focused study I'm going to talk to you about is one that I have nothing to do with, actually. Dr. Michelle Rivard, the other veterinarian at Marine Mammal Care Center, just got back actually from Sable Island and shared these slides with me. I wanted to talk to you guys a little bit about the work that she was doing out there because it's another pretty cool example of a population health focused field study that she was able to participate in as a veterinarian. So, Sable Island is 190, excuse me, miles southeast of Halifax, which is Nova Scotia. There's Parks Canada and DFO, which is the Fisheries and Oceans Canada facilities out there. And it is a windy and wet place. I think they got a lot of snow this past season. There's a number of species of birds there. There's also wild horses on the island. So that image is real. It's not AI created. It's wild horses and gray seals in the exact same place. And it's actually the world's largest breeding colony of gray seals. 400,000 gray seals breed on Sable Island each winter. So seems like a pretty cool place. And then the research that they're working on there, population ecology, they have a very robust brand resiting program that consists of 80% of the population of gray seals in the North Atlantic. So this allows for accurate modeling to monitor changes in the population by age class. For example, in recent years, they're actually seeing an increase in pup mortality that could have significant population impact. So being able to monitor that with brand and recite is a really important part of their program. That image on the bottom right shows a branded mom and pup combo. It also allows for an opportunity to track animals and their offspring throughout the duration of their life, which is pretty amazing. Um, in 2025, a female was cited that was born in 1979. And because of this program, they knew how many pups she had, the pup weaning mass and everything, which is pretty amazing to have so much data. Um, They also do physiology work. For example, they look at maternal to pup iron transfer and what impact that has on pup diving and foraging ability. And then field anesthesia, of course, similar to what I was doing on Guadalupe Island. That's a big part of it, just how to safely immobilize animals for short and long procedures in the field. I know some of the ones they're doing are short, like 15 minutes, and some of them are quite long, like 90 minutes. So Michelle has worked hard to help develop the ideal drug combinations and monitor the patients while they're under sedation to make sure that they are safe. There's also disease surveillance, including taking swabs for uh, influenza and COVID. And then they also do oops, I'm sorry. They do they're doing telomere studies, which is pretty cool. Gray seals, they live for a long time relative to other pinnipeds. And so they're looking at telomere studies to further examine if this is a component of their long lifespans. They also put satellite tags on them to track their movement, and they do diet studies to examine the diet of the mom and whether that has an impact on pup weaning mass, things like that. So, a lot of cool research that goes on with this gray seal population. And then Michelle did a really nice job of kind of summarizing how these studies contribute to conservation efforts. I think a lot of these apply to other population health and field studies, including the one that I was a part of on Guadalupe Island. But a big part of it is increasing clinical proficiency in the field. So that includes animal handling, sample collection, field anesthesia, things like that. People who work in a marine mammal rehab setting and are much more used to animal handling are valuable in these sorts of settings for that reason. And then information sharing and networking. This species, gray seals, can be harvested in Canada, so robust ecology program and population health understanding is really important for that. And then contributing, of course, to the greater scientific community in terms of population ecology, physiology, field anesthetic protocols, also that can be extrapolated to use for other species as well, and then movement and behavior. Okay, finally, we're going to talk a little bit about an ecosystem health study that I have been working on. And as I mentioned, it really could fall into any category, but here we go. This project is focuses on antimicrobial resistance in northern elephant seals. And just for a little background, it kind of came to be because of some questions that people were raising about kind of broadly the human agriculture wildlife interface, particularly at this one location at Point Reyes National Seashore in it's a north of San Francisco Bay Area. And there's this beach here, Drake's Beach, which is on Drake's Bay, and there's these agricultural farms in the area. So there's actually places where the cattle and the elephant seals come into quite close contact with each other. And people were just raising questions about what impact that might have on elephant seal pups that are born in the area. And that's not a simple question to answer, and it wasn't one that was brought about because of any sort of mass mortality or perceived illness in this population of elephant seal pups. They subjectively seemed okay, but people were just wondering about it. And so it was an interesting opportunity to look a little bit more into this question and to utilize northern elephant seal pups as kind of ecosystem health indicators. They're unique in this way for a couple reasons. One is that there's an opportunity for sampling. The pups in particular, they're relatively docile creatures. It's possible to collect samples from them. For this study, we were taking rectal swabs without any field anesthesia or sedation. And they also they're born on this beach. They stay there with their moms, nursing intensively for about a month, and then their mom leaves, and they still stay there for another month or two, fasting and kind of staying in the same place, exploring their environment to some extent. But that also is a really good opportunity for sampling, collecting samples from them over that period of time, which is pretty unique for wildlife health studies in general. So that's one of the reasons that I was interested in this. And then, to look at the question of how is this, human agriculture wildlife interface playing a role in elephant seal health? That's a really challenging question to answer, and you could look at it from a million different angles. But we decided to look at it through the lens of antimicrobial resistance, partially because this was a continuation of some research that was done around 20 years ago by Dr. Robin Stoddard for her PhD. She looked at enteric bacteria and antimicrobial resistance in elephant seals in this area. So there was some foundation for this work. So we decided to continue it. These pictures just show you the environment that these elephant seals are in. Of course, when it comes to a question of agricultural runoff, that's also a variable based on other factors. Like one year that we were out there was more rainy than the other. So there's a lot of factors that go into it, but um, just to give you a sense of kind of the environment that we're collecting samples from. And then, so for the first couple years of this study, we were just looking at environmental exposure, so collecting samples from animals in that area as well as in other areas to see if there were any differences in their antimicrobial resistance profiles and things like that. And then in 2024, we decided to expand this study on antimicrobial resistance in elephant seals to include rehabilitation. So we actually took samples from elephant seal pups, stranded animals that were in rehab at the Marine Mammal Center, not down here, although it could have been, to look at that impact of rehabilitation on development of antimicrobial resistance as well. It's kind of a full circle. The animals in rehab allow us to learn a lot about ecosystem health based on what they're coming in the door with. But also, the goal is to then release them back into the wild. So, on the tail end of that, we want to understand the impacts of our program on the health of the ecosystem. And of course, antimicrobial resistance is just kind of one small lens into that larger outlook of environmental exposure. But kind of a cool project that I've been working on and is not nearly finished at this point. We are just in the stage of kind of starting to look at the samples and do some tests, but something that I think is a cool opportunity for research that has come from, my experience working with these elephant seal pups. So, some overall benefits of some of the research programs that we just talked about are advancing diagnostics and treatments to, have that direct clinical impact on our rehabilitation ability, increase clinical proficiency, fieldwork, animal handling. I think it's also really important. As people who work in a rehab setting, we see a lot of abnormal, and having the opportunity to go out into the field and look at healthy, normal animals is really important to be able to evaluate the abnormal. So I think that as a clinical proficiency is a big benefit of participating in these sorts of programs also. And then collaboration, all of these projects involve a number of different people and institutions, and just being able to make those connections is really valuable. And then, of course, contributing to the greater scientific community. I think that being able to participate and contribute in research while we're working in marine mammal rehab allows us to extend our impact of rehabilitation beyond just the individuals in our care. So that's something that I feel really strongly about and is one of my favorite parts of my role as a veterinarian working in a rehab setting. All right, that's all I have for you. Thank you so much for your attention. And if you have any questions, I can take them now.
Thank you very much, Madison. We have a bunch of questions for you. And our first is going to come from Adia. She's asking about how remote was Guadalupe Island, and was it difficult to get there and get your supplies there for working in the field?
Yes, that's a good question. It's logistically a little bit complicated to get there. Um, the team that's been out there many more times than I have really has it down. So I came in at a time when I didn't have to work out the logistics like they did early on, and they really are pros at this point. But I know that it took them a long time to even be able to get out there, and they work really hard on the logistics side of things. How we got there, if you're curious, from the US, we drove from San Diego to Ensenada, Mexico. And then we took a small plane to the island, which is about an hour and a half or so flying. You can also take a ship there, but it takes about 24 hours. And the logistics of getting equipment out there is super complicated and something that we spent a lot of time beforehand planning, and I didn't even, do the vast majority of it. From my perspective as the vet, one of the things that we had to consider was getting the anesthesia machines, that sort of equipment, and also the medications. We were kind of limited in how and what we could use to anesthetize them because of the logistics of transporting controlled medications and all those things. So something to consider as well, especially for an international trip.
All right, we have some specific questions about the testing. Do you use antibody testing for any other diagnostics on a regular basis, or is there still testing for accuracy needed for these tests on marine mammals?
Yeah, that's a good question. We do use antibody tests for some other things. Something that I can think of right off the top of my head that we use antibody tests for all the time is for protozoal disease, so another type of infectious agent. Um, And most of the tests that we're using are not necessarily validated in the species that we're using them on, but there's kind of just a precedent that's been set. And if they're validated on other species, we can extrapolate and utilize them in the species that we're working on. But it's not uncommon at all for us to rely heavily on a test that technically hasn't been validated in that particular species.
Right. How long do Guadalupe fur seals pups stay with their moms? How long do they nurse?
They nurse, let me do the math. So they're born, June, God, it's been a long week, June, July, August. Um, they nurse for they kind of have soft weaning times where they'll overall, 8 or 9 months total, but their moms will go actually on quite long foraging trips at times and leave them uh, on the rookery to kind of fend for themselves while they're gone. And so it's a long period of time, but they kind of wax and wane in terms of, how much time they're spending actually nursing and with their mom. And that's one of the things that actually this research project has been looking into was kind of the lengths of trips that the moms are going out and foraging for and how that impacts the pup weight and stuff like that. So all research that's currently being done that we're trying to learn about.
So somewhat similar to California sea lions, but maybe they take a little bit longer trips.
Yeah, sometimes they're really long trips.
A question, are lepto positive patients treated with ABX such as doxy? Curious if there are any parameters regarding ABX use and how that is navigated. I think we have some veterinarians in the audience.
Yeah, yeah, that's a good question. They, it's not a simple answer. Because they're sometimes is the short answer. Doxycycline is a good antibiotic to choose if you are going to treat them with antibiotics, but because the bacteria is endemic in sea lions and there are animals that chronically shed the bacteria, we don't have a great sense of whether they all need to be treated with antibiotics. There's currently people looking into that, some research being done to kind of evaluate outcomes in rehab of those treated with antibiotics compared to those not treated with antibiotics. I think just anecdotally from my experience treating these animals, they certainly can recover without antibiotic treatment. And we don't routinely test. You could test their urine to see whether they're still shedding the bacteria after you treat them, but we don't routinely do that. It's not that easy to collect a urine sample from these guys. You have to generally put them under anesthesia to do so. And so, yeah, we could have a whole conversation about this, but the short answer is sometimes, and doxycycline would probably be what I would reach for if I was going to treat them with antibiotics.
We'll go with another drug-related question. What is your preferred drug protocol for field anesthesia?
Oh gosh, it totally depends on the species and also the length of the procedure, what you have available to you, and what you're going to be doing. So, yeah, it's completely species dependent. That picture that's on the screen right now, actually, I don't know if you can see, but those are elephant seals, and the one closest to us in the photo has a satellite tag. And I took that picture. It's in Humboldt County. That was part of a master's project for a student at Cal Poly that was looking at instrumenting elephant seals that were from this particular area to kind of see where they went. And this one popped up in Humboldt County, so we went up there to be able to recover the tag. And so, um, sedating an elephant seal in the field for something like just removing that satellite tag, I would use a completely different protocol than I would for, a Guadalupe fur seal. So a little bit, a little bit dependent on the overall situation.
Cool, thank you. How involved are community members or human populations in the studies that you've participated in?
In the ones that I talked about today, I would say really not very involved. The ones that I talked about today were a little bit more, focused and specialized research projects, but that's not to say that I can't think of any where there is a more of a, community component, particularly in population health studies that involve, counting animals in various places and things like that. But I don't think that there was really much of one in any of the ones that we talked about tonight.
Okay. What other fields besides biology and veterinary medicine do you interact with and collaborate with in your rehabilitation work?
That's a great question. Biology is such a broad one, though. So a lot of different types of biologists, like, um, you know, ecologists and field biologists who focus on marine mammals, and then also, a lot of kind of more lab focused biologists, immunologists, physiologists, all sorts of different types of biology that is related to, animal health in some way. And then also, I think the most important people that I interact with that I always am looking for more of are the people who are good with the data, the stats people, the data people, the data scientists in general. Some of these projects can involve collecting data that can be kind of hard to um, interpret and fit together, and that is not my strong suit. So if that's yours, please contact me. I'm sure I can use you.
Okay, we're going to do some career-related questions now. This one, what are your recommendations for someone that's looking to start their own marine rehabilitation center that they plan on in the next few years establishing in Brisbane, Australia?
That's awesome. Good for you. I don't know any of the regulations and, rules about that area in particular, but I think probably the best thing would be to go to a more established rehabilitation hospital or a couple and see how they do things, how the logistics of it. If you're building a facility, also super helpful to kind of see what works and what doesn't work as well from other facilities, and talk to people, because it's a pretty small and pretty collaborative community of marine mammal rehab people. And I'm sure people would be psyched to talk to you about it.
And thinking beyond the fields of biology, right? You're going to need a fundraiser to help support
Oh, yeah,
maintaining the
that.
fund, maybe government relations person, lots of volunteers to help. So you'll need a volunteer manager. So you need to definitely build a team together to make it all work. Okay, let's see. I have another one in here. Sorry. What was the most difficult obstacle that you faced? I think doing the research and field studies that you've done.
Um, I think that there's a few. I mean, in the field, there's different like day-to-day challenges that come up that when you're, in an isolated place with limited supplies, you're always kind of problem solving and thinking of creative solutions to problems that you might not have been able to foresee beforehand. So little things like that, but kind of on a bigger picture level, just with doing research in my job is just kind of time because it's, research tends to be, I think it's something that's super important, but in terms of the time that it takes a long time to do it and to do it well, and it's not really my primary job. So that I think is definitely a limiting factor for me right now.
Do you have a favorite project or study that you've been a part of?
Well, I think kind of both my favorite and my least favorite are probably the antimicrobial resistance one because it's kind of something that is my own that I kind of took and was able to develop and, kind of do all the steps myself, apply for the funding and everything. And so that makes it my favorite, but it also makes it my least favorite because it's uh, the hardest and probably the one where I make the most mistakes.
Let's see. How often do we get animals with toxoplasmosis, and what's their treatment, and how many survive?
We do see animals in marine mammal rehab in general with toxoplasmosis. I don't have the numbers for you on the frequency or the survival. I think, though, that anecdotally, well, I've probably seen the most sea otters with toxoplasmosis, which we don't tend to see down here in Los Angeles, but previously when I was working up north, would see more of those. And I think we've seen it in sea lions too, for sure, and harbor seal, other things, but it tends to be a tricky one. It's a tricky thing to treat, protozoal disease in general. It's hard to treat. It's a long course of treatment, and I think it depends heavily on the level of infection at the time of stranding, because if it's already to the point where the animal is clinically impaired, having neurologic signs, it tends to be a pretty poor prognosis. But if it's more of a, incidental finding or toxo light, if you will, maybe it's not impossible, certainly, but it's a challenging one.
And you'll need lots of help, like from registered veterinary technicians. But how often do you utilize
Technicians. How often?
registered vet techs in your work? Sorry, something weird happened.
That was weird. How often do we use them?
Yeah.
Every day, all the time. They're essential to our work for sure.
And let's see. Oh, how do you connect with researchers that need veterinary support? Do they reach out to you or do you reach out to them?
A little of both, I would say, but mostly, it's a reasonably small community of people doing this sort of work when you really get into it. And so sometimes they reach out to us based on talking to other people. Sometimes we're talking to other people who say, hey, you should reach out to, it's just a pretty small world. So either way, though, I would say both reaching out to them and having them reach out to us. Or, sometimes it happens like, oh, we wanted to bring this other person, but they're not available. So maybe you can do it instead. And that's kind of, things like that happen all the time, but it's a pretty small world.
We'll have two final questions here. First one, there's a lot of people that would like to make a career of working in the field of marine mammal rehabilitation. Do you have any advice to give people about taking that pathway and what they might do?
Yeah, sure. First, I think, there's a bunch of ways to do it. Like I went down the veterinary route, but that's certainly not the only way and not for everyone, and maybe doesn't even let you do the coolest stuff all the time. So I think, consider all the ways, all the things. There's a lot to do. And then also, I think, how I kind of figured out what I wanted to do was basically by process of elimination, like trying things. And if it didn't work out or I didn't like it or it didn't really work with my skill set, I kind of had to, pivot and move on to the next thing. And I know that might be kind of a frustrating answer, but I feel like you just really have to try things and get in there and see, because it is, this field is tricky and it's a big investment in, time and education, and you might have to, pursue internships and things like that to be able to get started. And if you do all those things and then decide that you don't really like it that much, then, it would be better to know that earlier. So I would say just try things.
Yeah, it's the advice I give as well. I mean, while you're in school, it's a great time to volunteer at various places to see if, a veterinary facility is a place that you'd want to be at, or a rehabilitation facility, meeting with professors and talking with them about their research. You can explore different places that might gain your interest, and then you can, take little bites of it before you, get the whole meal, I guess.
Yeah, exactly. Have a snack.
Have a snack. We had another question. You may have people may have in Instagram or in the news. We know we have a domoic acid outbreak right now, or domoic acid toxicosis is affecting many of the animals here in LA County. Do you want to just give us a little news update on what we're seeing here at the center and in general?
Yeah, sure. So just in the last, gosh, what day is it? Less than a week, we've seen an uptick in cases of California sea lions, primarily stranding with what we highly suspect to be domoic acid toxicosis. It's something that we see with some regularity at this point in California sea lions, and they present with neurologic signs. So often they're having a seizure. And that is caused by an algal toxin produced by a specific type of algae. And the sea lions get it actually from the fish that they eat. And so when we see it, we tend to see them strand in pretty large numbers, exposed to this acutely, so kind of quickly. And right now, we're seeing a lot of adult females strand with neurologic signs, although yesterday we got an adult male in as well. It's not exclusively adult females. And and it, has to do with an algal bloom, which can be caused by a bunch of different things. To some extent, it could, just be the natural part of things. To some extent, it could be increased, or the likelihood could be increased by changes in water temperature, nutrient composition in the water, but we don't know for sure kind of what the cause of the bloom is. We just know that this is what we're seeing in our primarily sea lions right now.
Yeah, we know that the trends in harmful algal blooms are on the rise, connected with climate change, ocean acidification, and eutrophication. So this is the kind of what we would expect from a future with ocean change. We know that this is going to be coming and something that we have to be prepared for. We're working on doing that through developing new clinical techniques and working on helping to rehabilitate the patients that we see, but also in expanding our capacity to bring in more animals, because we see a future of change being a future where we're going to need more rehabilitation of seals and sea lions rather than less. And part of our mission here is to make sure that people know that there are things that we can do to change that future. And we can't ultimately change, stop climate change. It has some inertia, it's going to happen, but we can mitigate how bad it's going to be. So reducing our dependence on fossil fuels, thinking about alternative energies, and really thinking about all of the different stresses that we place on our environment and our marine environment. If we can lessen some of those other stresses, then we might be able to create a more resilient wildlife population. But it's an excellent question, and we're seeing those effects, and um, happy to continue to talk about this. If you ever want to come on down to the Marine Mammal Care Center, we can have a long conversation. We have a couple other questions here. Can you allow? Oh, okay. Colleen, who asked the question, is this stranding event similar in numbers to the stranding event in the LA in the last 2 years? Right now, it's just the beginning, Colleen. So we don't know for sure, and we hope it won't be, but we are prepared if it is. Um, can you elaborate more on your role of being a veterinarian for research? What do you do most of the day? What is a day in the life of Dr. Peters?
Yeah, so a day in the life, most days are not anything like being on a beach anesthetizing whatever animals on the beach. Most days are spent in our rehabilitation center in the hospital, treating the patients that we have on site, trying to get them through rehab and back into the ocean. From the research side of things, what that involves kind of on a more day-to-day level is sample collection and storage. So we bank samples that we collect from our patients, like serum, whenever we draw blood for clinical diagnostics, we'll bank some serum in case we are using it for research later on, things like that. And then also for the patients that are in our care that don't make it, I often do a necropsy and collect samples from them for various things, for collaborative research, for diagnostics, things like that. So on a day-to-day level, it's not so I'm not like doing a research project. It's just kind of little pieces here and there that we can use to contribute to research overall in the future. Hopefully, these things take a long time. So day to day, it doesn't seem like my goal is necessarily research, just kind of, putting things in the freezer, stuff like that.
It is a job, right? There still are, the minutia of day to day. But we're really lucky to have you, Dr. Peters. You're a wonderful benefit to our team, and we look forward to amazing things in the future. So thank you, everybody, for joining us tonight. We had some more questions still coming in, but we're going to have to cut off for the night. I really appreciate everybody for joining us here. I could say come on down and visit us Friday through Monday from 10 to 4. We're open for public visitation. We're often here. Ask for us. We'd love to come out and say hello if we can. Dr. Peters is usually pretty busy, but we'll come out and say hi if we can. So thanks so much for joining us, and we wish you a wonderful evening. Thanks so much.
Thanks, everyone.